Hey everyone, this is Paul from Ortho Eval Pal, and today what I want to talk about are the 5 most common signs of low back arthritis, especially joint pain in the low back. There are so many different diagnoses associated to the back. We hear about herniated discs, and we hear about sprains and strains and things like that. And we hear about arthritis and spinal stenosis. But today I want to talk more specifically about joint pain in the low back. Okay, so what is arthritis in the spine? Well, first of all, I want to talk a little bit about the orientation of where we are here. Okay, so if you take a look back here, these are the little spines that you feel when you kind of feel back there. It goes all the way up your back, and we have some right here. These are your lumbar. And what we do is the joints exist on each side of that. Okay, so I'm just going to draw in where these joints exist. Okay, it's pretty much to each side. Now you need to remember this, that there is a lot of muscle tissue between the skin and these joints, and you can't really feel a herniated disc or a bulging disc, but you can get to these joints which exist right in this area here. So what I'm going to do is I'm just going to bring up my spine model right here. And if you take a look, these are the spinous processes. This is the bump you feel on the back. And right here is what we call the facet joint. You can see how the bottom vertebrae holds this part of the joint. The top vertebrae has this part of the joint. And they sit on top of each other. That's what keeps the back of the spine up and elevated. These joints have a capsule tissue around it, so basically like a water balloon around it to help hold the fluid inside the joint, helps to hold that joint together, but still allows a little bit of motion in that area. Now, you can see here that it does have a nice smooth lining to it when we're young. As we get a little bit older, that lining inside the joint, which is supposed to be a hard cartilage, can become pitted a little bit. And when it does, it can start to break down. It can start to expose some of the nerves. It can cause inflammation and swelling in that area. And the other thing that can happen is it can cause some stiffness. All right, so some of the signs and symptoms that you might have some arthritis inside one of those joints would be isolated, localized back pain. Okay, usually you can put a finger on it and say it hurts right here or it hurts right here, and sometimes that will radiate out around the buttock area. Very seldomly does a facet joint problem send pain down your leg like a herniated disc would or like a nerve injury would. So that is one of the most common signs that you have that. The other thing that can really cause this to flare up a little bit is if you back bend. Okay, because when you do that, it closes up that joint, or if you side bend and maybe even rotate a little bit to this side, that closes it up even more. Now, if we go upright and we bend forward a little bit, that opens up the joint, and most people get some relief when we do that. Okay, so that is part of the treatment plan when somebody has an irritated or inflamed facet joint. We try to open that up a little bit by strengthening the abdominal muscles and stretching the hip flexor muscles on the front just to get that to open up some. All right, and that is another sign that you might have facet joint arthritis. Now, the next most common sign is stiffness, especially with inactivity. So you sit down for a long period of time. These joints, like any other joint in your body, if you have knee arthritis or shoulder arthritis or hip arthritis, when you stop moving, you get a little bit stiff. Like you're really stiff in the morning, right? When you take your first couple steps. Well, your back is made the same way. It has lots of joints in it, and they can become stiff also. Now, as a result of having this irritation to those joints in this area, what we do know is that you can develop some localized muscle spasm. So when you touch the back, these muscles may be really, really tight. You may not be able to move as well because they're in spasm. And that is just a protective mechanism that helps to kind of stabilize that joint. All right. And the last thing that I would say that is quite common with people who have facet joint arthritis is that you may have a little bit of crepitus or a little bit of noise in your joints. Okay. They do become a little bit rougher. The surfaces of the joints are not as glossy and smooth as if they were when we were, 18, 19, 20 years old. And so they can become a little bit roughened and you may hear a little bit of noise back there. But believe me when I say this, noise in your joints is not always a bad thing, okay? If there is a definitive pain with the noise, that is something that may be a little more concerning, especially if you can reproduce it. But we don't worry about that too much. Usually as you become more flexible and a little bit stronger, that noise settles down. So there you have it, folks. Facet joint arthritis, the most common signs that you have it. Hope you enjoyed today's video, and if you did, please give us a thumbs up and be sure to subscribe. Thanks.